Here's a list of my courses, and let's choose the course talking about the USMLE cases and quizzes. And let's scroll down the cases and choose, for example, this one. In today's case discussion, we have a 36-year-old patient complaining of swelling in her feet. Recently, she had to buy larger shoes to accommodate this swelling. She also complained of difficulty sleeping, and her husband mentioned loud snoring, which she had never had before. The patient works as an elementary school teacher and stands for long hours a day. Which of the following tests is most appropriate for this patient? So if we check the key features, we have a 36-year-old patient who is a teacher, new swelling in the feet, difficulty sleeping with loud snoring, and all of this is very consistent with acromegaly. Most cases of acromegaly are caused by pituitary adenoma, which is a very small tumor in the pituitary gland that secretes large amounts of growth hormone. We see this condition mainly in patients aged between 30 to 50. Growth hormone stimulates the release of insulin-like growth factor-1, and this causes acromegaly symptoms. If this condition starts in adulthood, it will cause acromegaly, but if it starts in childhood, it will cause gigantism. Symptoms-wise, we see swelling of the hand and feet, deepening of the voice, very loud snoring, insulin resistance, frontal bossing, and hypertension. The initial test is insulin-like growth factor-1, and then MRI is necessary to locate the pituitary adenoma. It can be treated medically or surgically, depending on the size of the adenoma. Surgically, we simply remove it, but medically, we can use octreotide, pegvisomant, or cabergoline. Here are the guidelines. And of course, as always, you will have them in the description. And so if you go back to the question, we now know that these symptoms are consistent with acromegaly because the patient is an adult, and the initial test is insulin-like growth factor-1. If they ask for the next test, that is MRI. Use the link below to get access to the full course, including many cases and hundreds of quizzes. Everything in the course is high yield and common topics that we see frequently in the exams. Basically, we sat down and looked through a large number of question banks, quizzes, and many repeated exams. The topics we've chosen for this course are the most repeated topics, so they are very, very common. Thank you for watching.